Hi friends, today I'm going to talk to you about the extra-intestinal manifestations of Crohn's that I experienced during my first flare, because I don't think we talk about this stuff a lot. Everybody knows that Crohn's gives you butt problems, and that's true of all the IBDs, but there's some stuff it can do to other parts of your body that are worth keeping an eye out for if if you have a family history of Crohn's or whatever. You get the idea. So first of all, extra-intestinal means outside of the intestines. So again, Crohn's is inflammation in the digestive tract. I'm not going to go any more specific than that, but it can cause inflammation elsewhere. So I, for example, as my username might tell you, developed uveitis, which is inflammation of various structures inside of the eye. It can be very dangerous. It is vision threatening. Mine was caught relatively quickly, although I had to bounce across a few ophthalmologists to find somebody who knew what was going on. So if you have any eye changes in addition to like stomach problems and some of the other things I'm going to talk about, please see an ophthalmologist while you're trying to find someone to diagnose whatever else is wrong with you. It's very, very important. The other thing that is fairly typical with Crohn's, especially if you have a bad flare, is joint pain. Now, mine is probably also psoriatic arthritis. We don't really know because I have a history of psoriasis. But if you have joint pain in addition to stomach problems and the other stuff I'm going to talk about, it's very suggestive of Crohn's. It's non-specific, so it could be caused by any number of other things, but it's another kind of tick of the box. And actually, by the way, for the more medically inclined of you, a lot of the Crohn's like scoring systems include a lot of the symptoms that I'm talking about. So this is backed up by literature. Okay, so the last one that I want to talk about is the rarest, and it was also the scariest for me as a patient, and that was that I developed pyoderma gangrenosum, which is a very specific type of skin inflammation. As the second word in that medical explosion might imply, it's not great, and it needs to be treated fairly emergently. Luckily for me, it was limited to only a few parts of my left foot, and it was sort of self-limiting once I was put on systemic steroids, but it's gnarly, man. Skin stuff is like... Anyway, the last thing that I wanted to mention here is that two of the most worrying symptoms that I had, which I only realized in hindsight were like a very bad sign, were sudden, unexplained, dramatic weight loss and just enormous amounts of fatigue. If you have either of those two symptoms, you need to find a doctor who knows how important those symptoms are, because those two things in combination with just overall feeling like crap can be a sign of serious autoimmune disease. They can be a sign of various cancers. You need to be investigated if you feel very tired and you've lost a lot of weight. So anyway, that is what my first Crohn's flare looked like. Again, it wasn't just my intestines, and a lot of my doctors missed it because I presented weird.